Boyer? Representative Boyer, where are we? House Bill 288. You want to tell us what it is and why we need it?
Good morning, Senator. Good morning, members. I present to you House Bill 288. This bill is about clarity and compassion in how we communicate during some of the most difficult moments a family can face. Under current medical terminology, the term spontaneous abortion is often used in clinical settings. While medically accurate, it can be confusing and at times distressing for patients and their families. House Bill 288 simply asks that the term miscarriage be placed alongside spontaneous abortion in medical documentation and communication. This ensures that patients clearly understand their diagnosis while using language that is more commonly recognized and less emotionally charged. And we ask for your favorable consideration.
Representative Boyer, you want to just inform the committee as, I guess, some of the issues. In fact, if you have ladies here that would like to provide their story, we can do that as well.
Yes,
would you like to do that? Please introduce yourself for the committee.
Okay, my name is Yvette Buller, and I'm here in support of House Bill 288. In May of 1984 and again in July of 1993, I lost two children, my son Nicholas and my daughter Michelle, both at 20 weeks gestation. Their deaths were classified under ICD-9 diagnosis code 632, missed abortion. But these were not abortions in the way that the word is commonly understood. These were deeply wanted babies who died in the womb. In both cases, labor had to be medically induced. I endured more than 12 hours of labor before giving birth to my children. After delivery, I still required a D&C because the placenta did not fully evacuate naturally. I went through labor, I gave birth, and then I went home without my babies. The experience itself was traumatic and devastating enough, but later, discovering the terminology used in my medical records felt like another wound entirely. The diagnosis language sounded as though I had attempted to end my pregnancies, when the truth was exactly the opposite. I wanted my babies. I was trying to bring life into the world, not end it. These losses occurred more than 30 years ago, and yet this terminology still remains embedded in medical language and records today. Words matter, especially in medicine, law, and grief. When terminology inaccurately describes what happened, it causes unnecessary pain to women and families already suffering unimaginable loss. A miscarriage should not be labeled in the same manner as an elective abortion when they are fundamentally different experiences. This is the 21st century. We can use language that is medically accurate, compassionate, and truthful. It's time to correct this. Thank you.
Thank you for your testimony. And you are right, words do matter. This is why this bill is important. So thank you. Yes, ma'am.
Hi, my name is Kelly Bro. My husband and I founded a ministry here in Louisiana, in Breaux Bridge, where we help families of child loss, beginning with miscarriage all the way to adult child loss. That's how I met Miss Yvette. But today I come before you today as a mother of loss directly impacted by the terminology used in medical coding and billing. My husband and I have experienced the loss of 4 children, 2 after birth and 2 within the womb. In 2012, during my 3rd pregnancy, I experienced the miscarriage of our son, Christian Ryan, near the end of my 1st trimester. During a routine ultrasound at 11 and a half weeks, I was told, "I'm so sorry your baby does not have a heartbeat." Because of my previous history with traumatic loss, my doctor recommended a D&C. I was in shock. After the procedure, I later received my medical paperwork and insurance documentation, and listed on the record was the terminology spontaneous abortion and missed abortion, and my heart just broke. I had no idea, no one ever used that language with me in my doctor's office, that it was classified as an abortion. It felt like a cruel joke. My doctor spoke compassionate language to me in her office, but that is not what was written in my medical records. Still to this day, it's still currently listed. My mind immediately spiraled. What if they were wrong? What if my baby had still been alive? Did I somehow consent to ending my pregnancy? I later called the office to learn that, no, that's exactly what medical coding is. Did I lose my son spontaneously? Yes. Was it an abortion? No, not according to the CDC. The CDC defines abortion as an intervention performed by a licensed clinician intended to terminate an ongoing pregnancy. Doctors no longer speak this way to women at the bedside, yet within medical coding, miscarriage is still classified using abortion terminology: spontaneous, missed, and threatened. Women often read these words during moments of trauma and grief, and now with digitized records, it's in their home without a doctor to hear or explain to them what those words actually mean. In our work, we're also noticing that sometimes doctors during intakes are asking women how many abortions that they had. The ambiguity with the language is causing confusion. Because the word abortion is so emotionally charged in 2026, many women do not absorb the qualifying word before. What they see when they open their chart alone is in a patient portal is that word abortion. And what their heart screams is, I wanted my child. I loved my child, and I would have done anything for my child. Physicians have already shifted towards compassionate language because they recognize that those language are harmful to women. Medical research, and psychological data has already researched that this is harmful to women, yet the coding terminology remains. Language shapes how people understand what happens to them. Language shapes grief, and so we respectfully support replacing these terms with clear patient-centered language. This is a small change, but for the women and families facing the loss, it changes everything for them.
Yeah, thank you for your testimony today. Earlier in this session, in fact, the bill's already passed, we considered a perinatal bereavement program. This is a subject matter that this committee is very familiar with, and appreciate what you guys are trying to do here today. And thank you for advocating on that behalf. Representative Boyer, is it my understanding that the coding terminology, is that a federal piece?
Yes.
Okay. Might be a good idea to also, perhaps do a concurrent resolution or a House resolution memorializing Congress to perhaps take a look at this at the federal level.
That is currently in the process.
Okay, great.
We have submitted that for that.
Okay. I know we have a few more people that are here wishing to speak, but we've got the board as Senator Butcher. You have a question on the bill, or?
Yeah.
Go ahead.
Yeah, thank you, Mr. Chairman. Representative Boyer, thank you for your understanding and signing off as the author of this bill, to Ms. Brewer and to Ms. Yvette. Where she went? Yeah, there you are. Thank you for being here today. I think you used, Ms. Brewer, compassionate language. And on behalf of so many mothers who have experienced what you all have experienced, this is a really, really important bill. As you said, it's been a while, and you're still carrying that. So I just wanted to thank you all for being here today and for advocating on behalf of so many others who are not here today, but have experienced that. Some who don't even know that their records indicate that today. Correct. And that's to me one of the hardest parts, that they until something comes up, another procedure, another opportunity to experience some type of medical situation, they don't know how it's labeled. So I just I wanted to just reach out and tell you all. The other thing that I wanted to say to Rep. Boyer is that the trauma and the drama and all of the emotions that you all are still carrying, how appropriate for Representative Boyer to carry this bill as a gentleman to help to identify the need for this compassionate language. And I'm grateful to him and to you all for today. And Mr. Chairman, at the appropriate time, I'd like to move this bill favorable. And again, on behalf of all of those who have gone through this, as you said, on multiple occasions, we're going to make that right move at the right time. And he's also indicated that we're going to ask our federal colleagues to to help us in this vein. So at the appropriate time, Mr. Chairman, I would like to move this bill favorably.
All right, thank you, Senator Boudreaux. That is noted. In fact, while we've just been sitting here, I just got some feedback from somebody in our federal delegation already that's apparently watching this, so this is already on their radar. Your motion is noted. We do have a few other folks that would wish to speak. Ben Clapper with Louisiana Right to Life, and is it Hilliard? Would you like to come down?
Mr. Chairman and members, thank you. Ben Clapper, Director of Louisiana Right to Life. We are a pro-life organization since 1970, and we advocate on behalf and with mothers and fathers who've experienced miscarriage and the grief that involves. I want to thank Representative Boyer for leading this bill, bringing this forward. We worked on the language a number of times, and Mr. Chairman, for your leadership on these important issues in this committee. I want to, in the process of working on this legislation, it began with striking the term spontaneous abortion and replacing it with miscarriage. Well, because the CPT codes are federally designated, we couldn't do that. So then this thing is, well, could we put the word miscarriage after spontaneous abortion in parentheses to try to send a signal that it was different and to just try to present something, because you've seen from the testimonies that this is a difficult issue. You'd like to be able to accomplish something while you're waiting for the World Health Organization to change CPT codes. So in House Committee, however, the language was changed, and I understand why it was done, to change it from shall to may. So right now, the way the legislation that you likely will approve says that a health entity may make this change. You know, it's our concern, of course, is having may in there means that the legislation may not actually do much, if not anything. It raises the profile of the issue. So I've been trying to determine, are there ways to address this that still helps patients and citizens of the state without infringing on medical care. In 2009, the state of Connecticut passed a law that required that all mammogram reports given to a patient have a notice about breast density placed in the report. And it has a paragraph about breast density. I could read it to you. And so it's a patient education report to be required, and it was since picked up in its law in California as well. Texas in 2023 required a law that stated that all health records presented to a patient have to have, quote, patient-friendly language included on the information to the patient. So there's some precedent of states taking action without changing CPT codes to place notices in documentation to patients on things that are particularly difficult for patients to understand and maybe confusing and somewhat archaic. So I've talked about this briefly, and we don't have an amendment. You don't have an amendment on this. But if it is the interest of the committee, I do believe an amendment could be drafted between here and the floor, for example, that would require some sort of notice to be put in patient-facing information. The language could be determined by the Department of Health, and it could even be made an effective date of January 1st or even longer if necessary to give the Department of Health time to address this. Systems like Epic and other things can support patient-forward information. And so I think it can be done, and I think we've heard from the testimony that it would be positive for the state to do this. I understand that there's some concern maybe from hospitals or doctors that it could be too laborious or too overreaching into their practice, but California and Connecticut did it with mammogram reports. Possibly that could be done as well. So my encouragement is to determine before this bill passes if this could be made somewhat more effective than the bill stands today. Thank you.
Well, thank you, Mr. Clapper. I do think that the bill, as it sits now, is obviously very important to not just us, but a host of people. And if there is an opportunity to tighten it up a little bit or make it even, and obviously improve it, that's something that we can certainly work on between here and the floor with the author of the bill. So, yes.
Hey, good morning. Thank you all for hearing this, and thank you, Representative, for carrying this bill. My name is Miller Hilliard. I'm on the board of an organization called Maddie's Footprints. We are also based out of Lafayette and have been serving Lafayette for nearly 2 decades and Baton Rouge for between 5 and 10 years. We provide financial support and emotional support to families losing pregnancies and then children 1 year or younger. I'm not going to take much time, but I'll echo what you heard from both of the lovely ladies before, both from our work with the people that we serve, and then also personally, my wife and I have lost 2 pregnancies, our son, Owen Michael, and our daughter, Lily and Hope, and then now are fortunate enough to be pregnant again, and during that process, in our onboarding paperwork, have to go and the questions ask, how many pregnancies have you had? How many abortions have you had? And I've had to sit there, as I'm sure thousands of other people in our state have, holding a crying wife saying, I don't want to put that I've had 2 abortions, but I also feel like I need to be medically accurate. It feels like such a simple change that removes additional emotional trauma from families, and specifically women that have already been forced to endure something that no one would wish on anyone. So I'll see the rest of my time.
Yeah, thank you for being here. Thank you again for sharing your story. I know that's it's not easy to do, so we appreciate it.
Thank you.
The board is clear. We have a motion by Senator Boudreaux. There are a few more folks here. Gene Mills, Christian Kiley, Brittany LaFosse, and Emma Perkue are here in support, not wishing to speak. Senator Boudreaux has made a motion that we report House Bill 288 favorable. Or are there any objections to that motion? Seeing no objections, that's been reported favorable. Thank you.
Thank you so much, members.
Thank you, Representative Board. Thank you for the bill.
Thank you.
Representative Egan?